Welcome everybody to our webinar tonight on F10 Victory Treatment Applications in Zoo Species. So we're shaking things up a little bit and we're going to do things slightly different. So I'm not playing my normal holding slides video. I'll quickly just walk through the platform for everybody that's new so that you know how to engage with us, how to engage with our speakers, how to ask questions and answer our poll. So a quick overview of our program. We're going to get right into our presentation with our two speakers that we've got online with us, and I'll introduce them now. But before we get into that, I would like you to please mark your calendars. Our next webinar would be on the 12th of October, so second Tuesday in October, and we're going to talk about treatment applications in wildlife. Really looking forward to that one. So quick and easy for you to ensure that you can hear us very well. Make sure that you've got a great connection, that your Wi-Fi is not used by any other devices in your house or Netflix streaming, any downloads, upgrades, anything happening in the back end. Make sure you are using the fiber or the Wi-Fi on your own. If you are struggling to hear our speakers, they are live with us. Please just turn up the volume on your own side. We can't control the volume from our platform, so you're welcome to use earphones and just turn up the volume on your side. If you do see the screen freezes or you can't hear any sound, please just refresh your browser. That 99% of the time sorts it out, and then you'll get right back into the platform and we can continue with the presentation there. So this is your view. On the right-hand side, you will see that you have a chat bar, and that's where we've been chatting. And I see we've got Dubai, China, US, Bloemfontein, Pretoria, everybody online. So such a global audience. It's really, really nice to have everybody online tonight. And thank you for joining us. If you want to chat, that's where you chat. Questions for our two panelists, Dr. Neil and Dr. Michelle Barrows, please post them in the little questions tab. So you'll see right at the top right-hand side, you've got chat. The next tab is your questions. The third tab is the polls tab, and we're going to run a couple of polls during this presentation just to test you if you're still awake and enjoying the conversation we are having. So we're going to do some polls. Click on the little polls as soon as you see a little red button next to it, and then you can cast your vote, and then we're good to go. So without further ado, I want to introduce your host for tonight. It's Dr. Neil Forbes. Most of you would probably know Dr. Neil Forbes, who's currently based in the UK, but he still owns property in South Africa, so he's a foot on each country, and he still spends as much time as he possibly can in South Africa. He gives his time quite freely to causes such as vulture conservation, the training of vets and avian orthopedic techniques as well. He is a diplomat of the European College of Zoological Medicine. He's also a recognized specialist in avian medicine, and he has lectured internationally for so many years and has contributed to over 65 peer-reviewed papers and more than 38 books. He refers to himself as retired, but that is to be debated. But nowadays he keeps himself busy with consultancy work revolving around zoo, local authority and welfare inspections and trainings, as well as teaching. He's also involved with the expert witness roles, captive breeding and conservation projects such as Hubara bustards and critically endangered species of vulture. He's also the veterinary advisor to health and hygiene, therefore our host for tonight. And we are so privileged to have him here for yet another webinar. And I am going to ask him to take over tonight and introduce his colleague. Over to you, Dr. Neil.
Thank you very much indeed, Corne, for the nice introduction there. Tonight is a really, really exciting webinar, and I'm really thrilled and really excited. My guest for this evening, as you've heard, is Dr. Michelle Barrows. Michelle graduated from Glasgow University in 1998, having previously obtained a zoology degree. She worked in zoo and exotic pet practice in the UK until 2003, when she became a full-time zoo vet at Johannesburg Zoo. She stayed at Johannesburg Zoo for 7 years, and during that time, she also provided veterinary services to smaller zoos such as Monte Cassino Bird Gardens and Loro Park Zoo, as well as NGOs such as Volpro, the Jane Goodall Institute, and the Mabula Ground Hornbill Project. She was also heavily involved with the Wattled Crane Recovery Project. In addition, she worked with wildlife, both large mammals in private game reserves and smaller wildlife casualties brought into Joburg Zoo by members of the public or nature conservation staff. In 2010, she moved back to the UK and became head of veterinary services and conservation medicine at Bristol Zoological Garden. Now, for those who don't know, Bristol Zoo is one of the big 3-4 zoos in the UK, so it's a really big, prestigious appointment that Michelle has there, and she's responsible for the veterinary care of the animals at Bristol Zoo Gardens and the Wild Place Project in the UK. And if any of you are in the UK and you haven't been to the Wild Place Project, I can honestly say it's absolutely fantastic. I had the pleasure and honor of visiting there 9 months or so ago, and this is absolutely wonderful. So do visit if you haven't. She has a strong interest in training vets and vet students in zoological medicine and is an honorary lecturer at the University of Bristol Vet School. In 2010, she received the African Association of Zoos and Aquaria Chairman's Award for her efforts to promote zoological medicine and medicine education within Africa. And until recently, she was the chair of the Education Committee of the European College of Zoological Medicine, a very big and important role there. She is a European veterinary specialist in zoological medicine, that's in zoo health and management, and also an RCVS, a Royal College of Veterinary Surgeons specialist in zoo and wildlife medicine, holding both the RCVS certificate and diploma in the avian discipline. She also has a postgraduate certificate in veterinary conservation medicine from Murdoch University. So it gives me tremendous pleasure to welcome Michelle into this webinar with me this evening. You know, the stuff that we've done already about small exotic mammals and birds and herps and so on, you know, that's kind of ordinary. But when you come to zoo stuff, not only we have so many different diseases, but so many different exciting critters, and have to create special ways of managing their treatment because of the difficulty in actually accessing the patient. So as I say, it gives me tremendous pleasure to welcome Michelle into this webinar with me. Okay, so off we go. And just to introduce things, as I say, it gives me great pleasure to introduce F10 in respect to the care of exotic zoo patients as the health and hygiene veterinary advisor, but also as a user of F10 products for more than 20 years. So what we have to consider is what makes F10 different. Well, first of all, there is safety testing of all finished products. So it's not the raw ingredients, but the finished products when they're going to get used by government accredited quality controlled laboratories for skin, oral, dermal, and inhalation safety. There is also efficacy testing of all finished products, again, by government accredited quality controlled laboratories. And there's also considerable information, testimonials, safety and efficacy data, and all the application instructions, and much more. And all those test certificates are available to you on the Health and Hygiene website at this link here. Just before I go on, sorry, I should have mentioned right at the beginning, if any of you who are watching are not native English speakers, if you go on to the YouTube link here on the Health and Hygiene YouTube channel, within 24 hours or so, this webinar, but also all the previous webinars are all there, and you can get simultaneous translation in your own natural native language. Okay. So moving on, we've got links there for all those efficacy and safety test certificates, the full details of dilution rates and contact times, really important stuff to know for all the different pathogens there. And application guidelines are also provided. Again, we have the link there. So it's true to say that Health and Hygiene provides added value to all its products across its range, with training and education of both distributors, clients and users with this and similar presentations, together with the comprehensive fact-packed website. So just to make sure you're all awake, I know you haven't got a lot of time to fall asleep yet, but we're just checking. So in this first polling question, you should answer tick every option which is correct for you. So A, I am aware of F10 and use at least one product. B, I only use F10 products for cleaning and biosecurity. C, I use F10 products for disinfection and also for patient treatments. D, I wasn't aware that F10 products were licensed for patients' treatment. and E, I use F10 by fogging on a regular routine basis. So if you would like to poll away there and tell us what you think.
So Neil, I'm not sure if you can see the poll results, but we've got about 32 votes in so far. It's climbing steadily. We have front runner 35% choosing option C. I use F10 products for disinfection and also for patient treatments. Followed by 30% I am aware of F10 products and use at least one of those. And then number 3, with 17% coming in, I use F10 fogging on a regular routine basis.
Okay, well, thanks everyone for your input there. It's always interesting to see the level of experience and knowledge of our delegates. Obviously, you use F10 products for disinfection and treatment is the top of the list there, so that is good. All right, so let's move on to look at the actual subject matter we've got to talk about here. And I'm going to pass over to Michelle. Michelle has suggesting here that she uses F10 in the treatment of upper respiratory disease, and we've got some birds here. So Michelle, tell us about these cases. You're muted at the moment, Michelle. Your microphone is muted. Lovely.
Sorry about that. Hello, everybody. So yeah, I've put some slides together really just to show the range of cases that I've used F10 in. Some of them are, like this slide, obviously are very similar to cases that you'll deal with in exotic pet practice, but hopefully they'll be interesting. So if we start with these, some fairly standard presentations for anybody really that's in avian practice, but at the top we have a grey parrot. So this was a Swahalicus subspecies, so they're related to the Cape parrot. And as you can see there, this one had a rhinolith. So actually came in, I think, because it was lame, but you know, had all this compacted material that we had to take out of the nostrils, a bigger one on the left and a smaller one on the right. And then underneath, you tend to get a discharge. So there was a discharge that we then swabbed, sent off for culture. And with these, you know, we'll typically flush the sinuses, flush the nares, just using F10 diluted 1 to 250. We'll do that a couple of times a day. We'll often nebulize them as well. This one, I think we just got a fairly mixed growth of Proteus and Enterobacter, and it was treated with F10 and systemic antibiotics as well. The one on the right was a young sun conure presented with sinusitis. We got a very heavy growth of Klebsiella from this particular bird. But again, treatment was similar, so nebulizing with F10, flushing the sinuses. And for those of you that don't do this regularly, you can see a picture at the bottom. So this bird happens to be anesthetized. This is the third case, the red-vented cockatoo. But you can do this conscious as long as you hold the bird upside down. So you're just putting the syringe with your diluted F10 into the nares and flushing, you know, sort of 5 to 10 mils each side, and then it'll come out the mouth. And this third case was a little bit more unusual. This is a group, we have a few of these critically endangered cockatoos that I think initially were a confiscation. So they come from the Philippines, they're really important birds. And we had a few of them that were showing upper respiratory tract signs. And this particular one, when we had a look at it, there was a discharge from the choana, and on cytology, as well as seeing some sort of degenerate heterophils, we also saw some nematode eggs. And these actually turned out to be Cyathostoma eggs. And I don't know if it was this particular bird, but one of the others, when we flushed the sinuses, we managed to get one adult worm, which we then sent to somebody at the Natural History Museum here in the UK. And they told us that it was probably Cyathostoma larry, which is a European species that's found in corvids and gulls and wood pigeons. The interesting thing was that it's supposed to have an earthworm intermediate host, and we didn't think it was very likely that these cockatoos were eating earthworms, but there does seem to be some some people dispute that, and they may also have a direct life cycle. And again, we were treating this one with F10 just to treat the secondary infection, but it was actually quite difficult to get rid of the nematodes. So we would go up there, these are at our second site, every couple of weeks, and we would flush them, have a look under the microscope to see whether we were still getting any nematode eggs. And certainly systemic anthelmintics weren't getting rid of them. In the end, we actually injected some diluted ivermectin directly into the infraorbital sinus, and that's what finally seemed to clear it. And we actually haven't had a problem with these for a while now.
Great. I mean, that's a really interesting case. And I have to be honest, put my hand on my heart and say, I've never seen or even heard of cyathostoma in a parrot. Obviously, we see them regularly in raptors, but that's a really interesting case. And I think if we can just touch on antimicrobial resistance, it's interesting here because your subconjugal case was Klebsiella, and I dealt with a couple of cases in the last 6 months where the pathogen in the sinuses has been an antimicrobial resistant, and in this particular case I'm thinking of, it was a resistant Klebsiella like your case, and systemic antibiotics alone just would not get rid of it, and yet when we flushed with F10, so we were giving deep flushes under anesthetic once a week, but also twice a day in a home environment. Then, whether it's the flushing effect, getting rid of debris and rubbish out of the sinuses, and then the antibiotics working, I'm more inclined to think that the F10 has probably knocked on the head, let's say 80% of the bugs, and then that left a small residue, which the antibiotics, which were supposed to be resistant, the pathogen was supposed to be resistant to the antibiotics, but by combining F10 and antibiotics, we were able to control that and get rid of the pathogens, which I think is a useful and an important application for a product like F10. Great. Okay, well, we better rattle on, otherwise we'll be here all night. So tell us about respiratory disease that you've dealt with in Herptiles as well, please.
So yeah, right. Sticking really with rhinitis, it's something obviously that we do see quite commonly in reptiles too. So tortoises, lizards, and snakes as well. So here at Bristol Zoo, we actually have a group of Egyptian tortoises. So again, really important endangered species. Again, they were actually confiscated quite a few years ago, and the group actually is positive for mycoplasma and herpes virus. And generally they're fine, but every now and then we do get a bit of a flare-up of the mycoplasma, and we can see some rhinitis. They might not eat quite so well, and so we will nebulize them and flush their nostrils as well. On the right, we've got a couple of pictures of leopard tortoises. So when I worked at Joburg Zoo, we used to get a lot of leopard tortoises coming in, either ones that had been confiscated by nature conservation or members of the public bringing them in. And you can see the little one at the bottom is clearly very sick indeed.
Yeah.
That one probably didn't make it. But again, we've seen herpes virus in these. The one on the right there, you can see actually when we anesthetize that one, because obviously some of them are very big and quite strong tortoises, you can't do very much with them conscious, and just pressing up, it had a nasal discharge, pressing up on the roof of the mouth, and you can see it was actually a piece of grass that was stuck in the nostril as a kind of foreign body.
Wow.
And then the skink at the bottom, so that was a 8-year-old blue-tongued skink that had a chronic bacterial rhinitis. So he was sort of sneezing, and we had to sort of keep removing plugs of sort of dried discharge from his nares. And again, we were flushing that regularly with F10. So I think on that one, we actually did get a multi-resistant Pseudomonas from it, but it was sensitive to F10. There were no bony changes on radiographs. So he was on systemic antibiotics, but also we were flushing and nebulizing.
Great. Another win for F10. Fantastic. Okay, so we've got another polling question now. Which answer best describes the use of F10 in combating antimicrobial resistance? A, pathogens that are antimicrobial resistant will also be F10 resistant. The more frequent the use of F10, the greater the level of antimicrobial resistance. Hence, if you do have antimicrobial resistance, F10 should be used sparingly. B, F10 and other disinfectants have no efficacy against antimicrobial resistance, but the use of F10 in practice biosecurity programs to reduce reliance on antibiotics is invaluable. C, F10 SC 1 in 250 can be used to effectively remove all antimicrobial pathogens from a patient. Or D, F10 and other health and hygiene products have exceptional efficacy and safety for use in a practice infection control program to reduce reliance on antibiotics. F10 SC may also be used to treat or reduce or remove the pathogen burden when an antimicrobial resistant pathogen is present in an accessible site. Or E, F10 SC comprises 6 active ingredients. This means that resistance to F10 SC will develop faster than it does to a disinfectant that only contains 1 active ingredient. So with this one, you only answer the one most correct answer, please. So poll away.
So just for our online audience, if you are battling to see the polls, depending on which device you are accessing it from, you are welcome to either select A, B, C, D, or E and put that in the chat as well. We'd love you all to participate. We've got about 33 votes coming in so far. We're going to give it a couple more times. Bridget is answering in the chat. She's choosing option D. So let's see what our audience do. 40 votes. So far we've got 90% of the votes for option D, 7% for C, and 5% for B. The votes are still coming in, but D is a very, very obvious front runner.
So if I can just discuss these results, if we can keep those up on the screen for a moment, Cornet. D is the correct answer, which is great and terrific to see so many of you getting that right. C, F10 1 in 250 can be used to effectively remove all antimicrobial pathogens from a patient. That's not quite right, because if the pathogen is in a location in the body you can't get to, then it's not going to work. So it's not quite right, but it's a nice idea. B, F10 and other disinfectants have no efficacy against antimicrobial resistance. Well, that's obviously absolute rubbish. But the use of F10 in a practice biosecurity program does reduce the reliance on antibiotics, and that's invaluable. That is good. But of course, F10 is very, very effective against a whole range of pathogens, including those with antimicrobial resistance. So we just look at A, pathogens that have antimicrobial resistance will also be F10 resistant. That is not the case. That does not happen. So I'm glad no one chose that one. And E, F10 SC comprises 6 active ingredients. This means that resistance to F10 will develop faster. No, it actually develops considerably slower. There is at the moment no record of resistance. At some point that may happen, but it will happen slower than it would to a single active ingredient. Okay, great. So let's go on from there then. Michelle, we've got some upper respiratory cases here in mammals. If you'd like to take us through those.
Yep, so we're sticking with rhinitis, and this little loris is Lorraine. She's an elderly loris, and she actually has a chronic, quite severe rhinitis. She's had a few other health problems over the years, and sadly she's got a malignant ovarian tumour at the moment, but so she'll be going to surgery quite soon. But anyway, she's had this rhinitis. We've done CT scans which showed that there was no turbinate destruction, so we suspected it to be bacterial or viral. We didn't really culture anything other than contaminants on bacterial culture. However, quite interestingly, we did eventually get a positive on a pan-herpes virus PCR, and we actually managed to culture quite an unusual herpes virus. I think it was a beta herpes virus, one that actually has only been reported in some kind of Asian mouse. And we're not quite sure where it came from, except that Lorraine actually was wild caught. So like a lot of slow loris, sadly, there's a illegal pet trade in them. And she ended up in the Middle East after being confiscated and then found her way into the European slow loris EEP. So anyway, we have given her a cyclovir for the herpes virus when the rhinitis was particularly bad, but we're able to manage it quite well with nebulizing her. So they have their little nest boxes that they like to go in on section. So it's really very easy just to shut her in there and nebulize her with F10 when we get a bit of a flare up of the rhinitis.
Which I think is a great example of how you can actually use F10 to give a non-invasive, non-stressful treatment, which basically you can't give in any other way. So it's a great example, and well done you for being able to do that.
So yeah, the other picture there is Brienne. She's a little mouse deer, and these are really very stressy little creatures. So I really put that there just to show how sometimes even these animals that you really don't want to stress out and you don't want to handle, you can manage to nebulize them safely. And she actually presented a few months ago with really noisy upper respiratory tract breathing, but she happened to be very heavily pregnant at the time, so we really didn't want to do anything to stress her out, and the keepers were able to again just shut her in the little box that they hide in, take her out, connect her up to the nebulizer and nebulize her. In this particular case, it actually turned out to be a dental abscess.
Okay.
And when it burst, the noisy respiration stopped, and she has actually now just given birth. So she gave birth about a week ago. The picture at the top is one of her previous fawns.
Okay.
So we do need to see her in clinic in due course, but at the moment we're just letting her rear her baby.
Sure. Excellent. Good. Okay. And then here we have a nice fun case of one the Deccan's hornbill. So tell us about this. We've got some really nasty infections here too.
Yep. So as you can see, he presented with some really quite dramatic defects in his beak. I mean, this is after debridement at the top, but he had these beak lesions on both sides, top and bottom. And on presentation, this really smelt bad. So yeah, wasn't very nice. So we took some samples for histo and culture and sensitivity. So you can see the results there. It was necrotic, severe hyperkeratosis, and this was a candida-like infection. So what we did is we debrided it as best we could. The bottom picture here, actually, we've put some F10 wound ointment into it, and we hospitalized this bird initially. I'm just going to move on to the next one. So we were cleaning this out regularly, applying the F10 ointment. This bird was also on itraconazole. And then once we were happy that we'd removed all the necrotic tissue, we actually applied something called Copac, which is this picture here at the top, which is a kind of dental putty as a kind of temporary filler. We had to be quite careful just to mold it around the nostrils there. And then we were able to send him back to section, but because Copac is quite easy to remove, we were able to have him back for checkups, remove it, just check that there wasn't any infection coming back. At some point, we then replaced it with Q-liner, which is a sort of harder resin as a more sort of permanent sort of replacement. And he did very well. He did eventually rub that off, and then we saw him back, but actually by that point it was healing really nicely underneath. So that resolved completely.
Great. And another interesting case, because if you've got a candida within both the Rhinotheca and the Ramphotheca there, within the beak itself, which has a pretty limited blood supply, the ability to control that with systemic antifungals without draining it and flushing it out is in my opinion just about zero. So obviously it's got to be opened, and then of course F10 is a fantastic product to put inside there to go alongside the systemic. So again, a fascinating, interesting case. Thank you. Okay,
so yeah, I just wanted to talk a little bit about tracheitis. So unfortunately, this is a potential complication of intubation in birds. Also, interestingly, in fruit bats, because like birds, they have complete tracheal rings. So I'm sure you all know you have to be really careful with intubation, make sure you don't use cuffed ET tubes. But, occasionally you are unlucky and you do get cases. The one at the bottom, actually, this isn't the particular, I couldn't find a picture of the actual wattle crane, but this is another wattled crane. So this one is actually just being scoped to remove some pieces of metal that this bird had ingested. And the one I want to talk about, Thule, actually did the same thing. So she'd been placed into a new enclosure, so a newly built enclosure. And it turns out that the workmen had not cleaned up after themselves. And there were a lot of pieces of metal hog rings. So these were galvanized zinc hog rings that had been used, I think, to fix the wire on the fence or something. And afterwards, as cranes are likely to do, she's probing in the soil and she picked these up. And so she presented, and we saw lots of these pieces of metal on the radiographs. And so she actually had quite a few anesthetics initially to flush them out, but then we were able to borrow a bronchoscope to get them out. And she did develop a tracheitis, which probably was just a post-intubation because of all these procedures.
Sure.
Although it's also possible that with the flushing procedure, even though she was intubated, maybe some fluid went down there. And she was, very wheezy. With her, we were lucky in that we were able to remove basically a thick plug of mucus from the trachea, and then we nebulized her, and she actually did very well. We got on culture, I think we got a heavy growth of E. coli and also a Bordetella. The one on the right is one that didn't turn out quite so well for the bird. So this was a scarlet macaw, also had a post-intubation tracheitis. So typical case, really, it tends to be about 2 weeks afterwards. They start wheezing, they're very dyspneic. Again, hopefully you can see on the radiograph there, you can see that where the tracheal obstruction, the stenosis is. And this bird actually had to have a tracheal, had to have an air sac tube placed and a tracheal resection. And obviously, when you're doing the resection, you have to be really atraumatic and really careful, because obviously you don't want to then get another stenosis at the site of the surgery. So again, during recovery, while this bird was hospitalized, it was nebulized with F10 just to sort of help with the healing of that surgical site.
Great. If I can just chuck in one little clinical thing that I've had sitting in my cupboard in my hospital for many, many years, and sadly only been able to use it 2 or 3 times. But thinking about your hog rings there, this technique I have is a plastic tube, and inserted inside the plastic tube are what are called micro magnets. So you can push these magnets inside the tube and then seal the end with super glue, cyanoacrylic glue, and then basically use the tube like a stomach tube, and you can pass it down into the proventriculus or even into the ventriculus. And I'm not saying you're going to get every piece of metal out, but certainly it can be incredibly useful getting out screws and nails and keys and all sorts of things. As long as they've got some ferrous metal in them, then generally speaking, they will attach to the magnet in the tube, and you can retract them. So just a little tip, nice and easy, very cheap, very non-invasive. The only problem is you can never charge the patient, the owner, enough for doing that sort of treatment, because it's so simple and so easy and doesn't involve any great skill or complicated, expensive equipment, but just a nice little thing. Okay, so now we have respiratory disease in sloths.
Yes, so this is Sid on the left. So this is a little two-toed sloth, and her mother, Lightcap on the right, was really quite old. I don't think the keepers were expecting her to get pregnant again. Right. But she gave birth. Sadly, she had a retained placenta. So this was actually the placenta coming out a few days later. But clearly she was very ill, and she wasn't able to rear Sid herself. So we try as best we can to avoid hand rearing, but occasionally the keepers do end up having to do it. And of course, one of the things that can happen, particularly when you're just getting them used to taking milk from a bottle or a teat is that they get an aspiration pneumonia. And Sid actually had quite her fair share of problems. At one point, she also swallowed a teat. But yeah, she had an aspiration pneumonia. And again, we were able to, as well as systemic antibiotics, she was nebulized with F10. Obviously, really easy to do with a hand-reared neonate. And she did really well. And she's now at another zoo, and she's had babies of her own.
Great, lovely, nice story.
This one is very similar, so I kind of won't dwell on it too long, but another sad case, I'm afraid. I mean, whereas Sid's mother did survive, this one didn't. So this was a TT monkey. Sadly, keepers came in the morning, found that she'd given birth but had a prolapsed uterus, and she was already in shock when we saw her, so she didn't make it. But it did mean that her baby also had to be hand reared. So this is him a bit older on the right, and yeah, he also had a aspiration pneumonia, and again, part of his treatment was nebulizing with F10.
Great, and it worked.
And then this one, so this one actually I kind of put it in there just to show that even species that you might be a bit wary of doing too much with, it's relatively easy to nebulize them. So this was a meerkat with quite a nasty pneumonia. It actually turned out to be an angiostrongylus lungworm pneumonia. We did actually euthanize this one in the end, but while we were sort of making that diagnosis, even though we don't like to separate the meerkats from the group, because obviously then when you put them back, it can be very problematic. The keepers were able just to get her with some treats to come into a sky kennel and nebulize her on section. So relatively easy to do. We've also done that with some of our rodent colonies. So these are Turkish spiny mice, so quite endangered little mice. And we have had outbreaks of respiratory disease in them. Obviously, they're really small, so they can be placed in containers and again nebulized fairly easily.
And again, of course, because F10 is so safe and as well as being efficacious, that if you had to nebulize the whole group of mice, rather than stress one by separating it away, to be honest, it wouldn't be an issue to the patient or to the group as a whole. So it's another example of a very nice, non-invasive, non-stressful, effective medication. Great.
So I was just going to talk a little bit about nebulizing birds again, and particularly Aspergillosis. So we do see a bit more of this in the UK than when I worked in South Africa, and probably climate related, but also the species that we keep here. So this is clearly a bird that wasn't going to make it. So this was a little glossy starling that had Aspergillosis, and I had to euthanize. But it's really just to say that any bird really that presents with respiratory signs, we will usually just start nebulizing them while we're waiting for results to come back. And then obviously it's often a part of the treatment as well.
And the other point I would say there is that because Aspergillus is either due to environmental contamination or stress in the individual so that their immune system is suppressed, if one glossy starling has got Aspergillus, then the rest of the group are going to be at risk. So there's a very good rationale for actually nebulizing all of them at that point in time and until you get the problem resolved. Great. Okay.
So this is really kind of leads on quite nicely to this slide. We were unlucky enough to have quite a big outbreak of chlamydia a couple of years ago now. So this was in a mixed species exhibit. So we had 46 Inca terns flying around. We had, I think, 43 African penguins and a few eider ducks as well. And we lost one duck and I think about 6 or 7 penguins. And as I'm sure everybody knows, the treatment for chlamydia is quite a long course of doxycycline. It's not feasible for us to medicate all these birds, catch them up and medicate them orally every day. So we treated them with a long-acting doxycycline injection, and this had to be given once a week. And clearly that is very stressful. So it's a 7-week course. The exhibit that they're in is a very large aviary, and with all these Inca terns flying around, it just wasn't feasible to even just catch them all up once a week for their weekly injections. So they had to be temporarily housed elsewhere, and this was very stressful for them. So not just the injections, but just being in these other holding areas. And we did lose one to Aspergillus, so hopefully you can see at the top, you can see the typical sort of green fluffy fungus growing there. And we then started fogging the rooms that these inca-terns were in once a week. And yeah, we didn't have any further mortality from Aspergillus, and we actually didn't lose any inca-terns from the chlamydia.
Good.
However, what we did do, sadly, was we actually ended up with 2 keepers that were sick with chlamydia. And this is a picture from the penguin exhibit. And I don't know if you can see my pointer, but at the back here, we've got some nest boxes, and they have these kind of fake rocks on the top of them. So these are the lids. And when the keepers check on the penguins, they lift up these lids to have a look inside. And obviously, once we had the first death, which I think was actually the eider duck, the keepers were keeping a close check on the rest of the birds. It was actually they were coming up to nesting time, so a lot of them were in the nest boxes. And I think probably what happened is that the keepers, as they lifted a lid, you can imagine that they would sort of inhale the dust that's in those nest boxes. So before, I'm sure they became infected before we had our diagnosis. Obviously, as soon as we knew what we were dealing with, they were in full PPE, but they disinfected all of the nest boxes with F10. We're very lucky here at Bristol, touch wood, that we don't really have a problem at all with aspergillosis in our penguins, but many zoos do. And again, obviously, disinfecting the nest boxes with F10 would be a useful thing to do for that as well.
Great. If I can just chip in there, and I think the point I wanted to raise is obviously for vets who are watching who see parrots and other birds in practice with chlamydia and treat them, just a reminder, and this is something I've always done, that chlamydia remains viable in the environment for up to a month, so that if you're treating a client's birds, what I would normally do is maybe halfway through the chlamydia treatment, I would actually loan the client a fogging machine and get them to fog the whole airspace where parrots have been, and probably the next room as well, from the point of view of preventing reinfection of the parrot, but also because of human safety. Obviously, we know it's a serious, potentially serious zoonotic infection. So, taking that precaution to prevent chlamydia infection is important. Okay, so we got another polling question here. And again, you just answer one of these questions. So which one statement is most accurate in respect to the use of F10 products in zoo patients with respiratory disease? So A, F10 SC 1 in 250 in saline can be used to treat respiratory disease in any species by placing the patient in a room with a fogging machine which delivers F10 fog. So that's treating respiratory disease with fogging. B is if F10 is applied by fogging or nebulization, the area should be well ventilated for 30 minutes before staff re-enter the room in case they have an adverse reaction to the F10. C, F10 SC 1 in 250 in saline should be applied by nebulization, generating a particle size of 0.5 to 2 mu, so that the particles are carried as far into the respiratory system as possible. Nebulization should be conducted 3 times a day for 30 minutes, typically for a 5 to 10 day period. Or D, F10 SC 1 in 250 in saline should be applied by nebulization, generating a particle size of 2 to 5 mu, so that the particles are carried as far into the respiratory system as possible. And nebulization should be conducted 3 times a day for 30 minutes, typically for 5 to 10 days. Or E, F10 SC 1 in 250 in water should be applied by nebulization, generating a particle size of 0.5 to 2 mu, so that the particles are carried as far into the respiratory system as possible. Nebulization should be conducted 3 times a day for 30 minutes. So if you would like to hit the box that you think is most accurate and submit. We'll see how you all do. Okay, so the results are looking good. C is the correct answer. So the points here to note, using F10 1 in 250, F10 SC 1 in 250 in water is absolutely fine in most situations. There may be a benefit in putting it in saline when you're putting it inside, for example, the lung or inside a body cavity. So that probably is preferable. Generating a particle size of 0.5 to 2 mu, that is the recommended thing for bird treatment, and it works just the same for mammals. So a nice small particle to get as far down the system as possible. So everyone, the people who all got that, that's absolutely correct. D, this is F10 SC in saline, should be applied nebulization, particle size 2 to 5. Now, something's gone wrong there. Okay, I'm confused about that right at the moment. I think there must be a typo there somewhere.
So some of the poll questions I had to make shorter because it's got a limited amount of characters.
Ah.
Okay. If you look at the questions that's on the screen, they are correctly translated to the votes. I just couldn't use the characters.
So if we look at D on the screen, D said F10 SC 1 in 250 in saline should be applied by nebulization, generating a particle size of 2 to 5 mu. Yeah, and that is wrong. It should be 0.5 to 2 mu. Okay, so the size of the particles is wrong in D. That's why D is not correct. E, F10 SC 1 in 250 in water. Well, as I say, although water should be absolutely fine, we feel that probably saline has got a slight advantage there. So not a big issue there, but that's why we think probably saline will be better. F10 is applied by fogging or nebulization. The area should be well ventilated for 30 minutes before staff re-enter the room. F10 has been tested for respiratory sensitization and toxic reaction, and we shouldn't get any problems in humans. Now, the only exception might be if you have a member of staff who's particularly asthmatic, for example, there could be a little bit of an issue. But in general terms, we don't expect any reaction, and it should be absolutely safe for staff to walk in there with F10 in the air. And then the last one, A, which a couple of people have said, can be used to treat respiratory disease in any species by placing the patient in a room with a fogging machine that delivers F10 fog. Well, a fogging machine will produce a fog with large particles, typically 5 to 10 mu in size. And that's why when you're treating a patient with respiratory disease, we do always recommend nebulization wherever possible, if it's actually treatment rather than prevention. So I hope that clarifies all of that, but well done, everybody. Okay, so that's that one. Right, so back to you, Michelle.
Yep, so moving on to dermatitis. So there's a couple of cases in snakes here, and with snakes, we might use the wound spray or the ointment, or sometimes even soak the snake in diluted F10, diluted 1 to 250 in warm water. I don't have a picture, unfortunately, of the first case. So mangrove snakes are really, really beautiful colubrids from Southeast Asia. And this one presented with sort of brownish discoloration to mostly the dorsal scales, which the keeper said seemed to be spreading. So we took a biopsy under local anaesthetic, came back as a superficial pustular epidermitis, something that's known as blister disease. On culture, we got staph and Pseudomonas. And this snake was treated with systemic antibiotics given every 3 days. And then at the same time, F10 ointment was applied to the lesions and improved really nicely within a couple of weeks.
Good.
And then the other one, which is the pictures that I've put here. So this was a couple of royal pythons that share a vivarium. And you can see, especially on this one on the right, again, the brownish discoloration. And this, these two snakes, it was actually more the ventral scales and some of the lateral scales. And this followed the keeper using a new substrate in the vivarium.
Okay.
And again, took some biopsies under local anesthesia and sent them for histo and culture. And I was a little bit concerned to get back a positive PCR for Ophidiomyces ophidicola. And this is an emerging fungal pathogen of snakes that has been quite problematic in particularly wild snakes in the US and also in Europe. I think there's a few rattlesnakes in the US that have been affected by this. But actually, again, this one actually was only treated topically. We used the ointment daily because the lesions here were on the ventral surface, so they would kind of get rubbed off on the newspaper. We obviously took the substrate out and kept these snakes on newspaper. And again, this cleared within a month. And after they both shed, they look lovely. So this picture here actually at the bottom is one of them after it had shed.
So these lesions were quite superficial, I guess?
Yes.
Yeah, great, fantastic. And you know, we all know that actually using antifungals in systemic antifungals in herptiles does carry a significant mortality risk due to toxicity. So the ability to use F10 for its antifungal properties here is really good. Excellent. On we go.
Right. So this was quite a challenging case. So this bird presented with these areas of erythema and flaking on the dorsum, also some abnormal feathers. So I think there's a picture on the next slide, but so had these sort of curling or corkscrewing abnormal feathers with sort of the retained sheaths. So again, we took a biopsy. You can see the results here on the left. So on PAS stain, they saw these branching septate fungal hyphae. So this was a hyperplastic dermatitis with intralesional fungi. We didn't culture the organism initially, although we tried. And we started this bird on itraconazole. So luckily it would take capsules in cherry tomatoes, I think it was, that the keepers would put those in. And we actually also was on non-steroidals, but we started shampooing this bird once a week with F10 shampoo. So it wasn't terribly easy. You can see that's what I'm doing here on the left. Obviously, cassowaries can be quite dangerous. So we would use a press board. And actually, he got quite used to this after a while, but it was challenging because you couldn't really see the whole bird. And it did clear up, but it did recur again about 5 months later. That time we did actually culture an Aspergillus. And we started the same regime, again, the F10 shampoo once a week. And once we actually stopped the systemic treatment, we continued with the F10 shampoo weekly for quite a few months before this resolved. And, you know, I think the bird actually tolerated it quite well. We'd sort of make sure it was warm. And I always wondered whether there perhaps could be an underlying viral etiology with the deformed feathers, but we never managed to diagnose that. And we think it was.
That's really interesting. And I think whilst we're talking about Aspergillus infection and itraconazole, I think it's only right that we actually share with our viewers that, of course, traditionally itraconazole was a human version, Sporanox, and yet we know that actually once we had available voriconazole, VFend, but also Fungitrax. Fungitrax is the first bird licensed itraconazole agent that's available. Both of those two, so voriconazole and Fungitrax, which is itraconazole, but it has a different carrier, and it achieves a 27 times higher concentration in the air sac wall. So both of those two are now well recognized to be vastly more efficacious than the old itraconazole, although that was all we had to use at that time. So no criticism here at all. But nowadays we will be trying to do a bit different.
Yeah, I mean, with this bird, unfortunately, it wasn't feasible to give it the volume of liquid we'd have needed to. So
sure,
the capsules work quite well in the
Absolutely.
cherry tomatoes.
Yeah.
So moving on to mammals. So we've seen a couple of cases of dermatitis in our armadillos. So these are 6-banded armadillos. I don't have a great picture, I'm afraid, but the first one, Ahmed, the armadillo, so he presented with sort of flaking, misshapen scales, some of which you could actually lift away. And of course, armadillos have sort of ossified dermal tissue and then these epidermal scales on the top. From him, we got a heavy growth of candida and also a multi-resistant staph. The other one, Tilly, which is a younger female, she presented, I don't know, it was a couple of years later. Similar presentation. Underneath the scales, there was sort of powdery material. We did culture an Aspergillus in her. And these, again, we treated these only with topical F10. So with Ahmed, the keeper sprayed him daily with F10 diluted 1 to 250 for a month, and it resolved. With Tilly, she didn't really like being sprayed, so they actually used the ointment on her. But again, that resolved really nicely.
Great.
Ringworm we don't see very often. I have had one case in a red panda. This was at Joburg Zoo. We cultured a Microsporum gypsium, which was resistant to quite a few antifungals. It was really affecting her tail, so we were actually able to, the keepers would net her, and we would again treat her with F10 shampoo once a week. So we just leave it on. So same with the cassowary. So we don't wash it off because that obviously means restraining the animal for longer. Which we just leave it in place.
Great. So I mean, obviously, leaving it on is a great solution, because of course, when you're treating topically in a shampoo form, you would normally say leave the shampoo on for 15 minutes. But as you rightly say, that would mean catching it, restraining it again, etc., and more stress. So in a zoo species, rather than washing it all out after 15 minutes, you'd leave it in, and it does the job. Okay. So on to shell lesions in Chelonia.
Yep. So I've used F10 on lots of different types of shell lesions in tortoises and turtles. This was the most recent one, just a fairly simple case of some bite wounds. So these are actually healing here on this picture at the top, but here on the plastron you can see a fresher one. So yeah, basically once a week, the keepers would catch up. This is a fly river turtle, take him out of the water. We would debride them. I would apply F10, again diluted, and then cover that with some Orabase, which is a paste that's sold here in the UK. We use it a lot for ulcers in fish because it stays on in the water, so it just protects it underneath.
So in that situation, why are you using F10 diluted rather than F10 barrier cream?
Just because I wanted to put the Orabase
over the
on top, because it stays on in the water and doesn't wash off. Yeah,
and obviously if you put Orabase on top of barrier cream, it wouldn't hold there, would it? Because of the interaction with the oils, I guess.
And Orabase, I think it's meant for kind of ulcers in the mouth in humans and things like that. It kind of sticks to the tissue.
Right. Okay, good, thanks.
So just a few more. Joburg Zoo used to get a lot of leopard tortoises coming in with quite nasty burns. This was a really bad one because you can't really tell from the picture, but there was a defect actually going into the coelom. So, and this was fly blown. So this one I think was euthanized, but we would get others, and we would use F10 ointment or wound spray with insecticide just to prevent them getting Flystrike. Obviously, you can't use ivermectin in Chelonia. Pictures in the middle are a couple of our Aldabran tortoises here. So we had one of those had a fairly minor shell lesion actually recently. I don't have a picture, unfortunately, but they do have a little bit of an issue with crickets in the tortoise house, and the keepers had seen some crickets on this little wound. So again, we were just applying the ointment with insecticide, and then on the right, this was a wild leopard tortoise that had got run over. So you can see I just repaired it with some wire, but again, we would just spray this with Joburg Zoo. We would tend to keep them outside, and so we just spray it with the wound spray just to keep the flies off.
Good. Okay, then flamingos. Pretty flamingo.
So flamingos are quite prone to foot lesions, and it's quite recognised actually that they have sort of 4 main types of lesions. The interesting thing is that different collections have different proportions of these lesions. So some of them have mostly papillomatous lesions like this one, whereas we don't see very many of those. The other one we don't really see is the nodular lesions. So these, you know, can then ulcerate. This is the only one I've ever seen actually, and this one was an abscess with a, you know, plug of pus that had to come out. We see a lot of hyperkeratosis, which is the one on the left, which doesn't really cause a problem. But the one that really causes us the most problems is the fissures. So as you can see here on the right. And obviously this is a husbandry problem, you know, it's related to substrate. So we do have a concrete pool, but the keepers put river sand in to cover up the concrete. But I think over time it gets washed away and they have to keep replacing it. And particularly in the winter months, we will see a few with these fissures, which are quite painful. So we always have a little bit of a dilemma, because obviously flamingos don't like to be hospitalized on their own. They like to stay in the flock. And every time you catch them up, you're chasing the whole flock around. And if the bird's lame, chasing it around to catch it up can sometimes be, you know, counterproductive. So, you know, it depends. So we'll catch them up and we'll apply F10 ointment. Obviously, if they're going straight out, it probably doesn't last very long. But if we have some that are bad, we will hospitalize a small group of them indoors together. And then we'll apply the F10 wound ointment daily.
Okay, so just for what it's worth, and some listeners may have heard me say this before, but when I was involved with looking after flamingos at the Wildlife and Wetlands Trust at Slimbridge, actually before my time there, but they'd had a very severe problem with Pododermatitis in their flamingos. And what they did is, at that time, the water in the flamingo enclosures was canal water. It didn't really matter if it was canal or river water, but what they did was they sunk a borehole and supplied the flamingos during the winter with borehole water. Now, the point is that borehole water will be 3.5 to 4 degrees warmer, and just simply by giving them that warmer water, that reduced the incidence of pedal dermatitis by 95%. So there seems to be an issue. Obviously, flamingos come from a warm climate, and during the winter in cold areas such as the UK, standing in cold water is obviously a feature. So yes, F10 is very useful, but if one can warm the water up a little bit, that also seems to be beneficial. Okay, so on we go. So here we have hoopoes with more foot problems.
Yep, so we do see pododermatitis obviously in other birds as well occasionally. This was a little bit unusual in that we had several hoopoes last year that were relatively young, and they all presented with different degrees of pododermatitis. Again, you know, it's going to be a husbandry problem, and these birds were in an indoor area that wasn't ideal. They were spending a lot of time on a concrete floor. I also wasn't particularly happy with their diet, so we changed that and we moved them to an outdoor aviary, and they did a lot better. But some of them actually did have, you know, plugs of necrotic tissue that had to come out and be debrided, similar to this next one really. So this is kind of the process. This was a plover again with pododermatitis, where you debride the plug of tissue. Ideally you send a sample for culture and sensitivity, and then we'll often put a drop of diluted lidocaine on there, and then we'll put a bit of F10, and then we'll bandage it up because you want to take the pressure off. So in this particular one, it looks like they're using a leave-in and then putting some vet wrap around that, and then we'll change the bandage every few days, reapply a little bit of F10. Obviously, they're often on systemic treatment as well, depending on what we've cultured. You often get quite a variety of opportunistic bacteria, sometimes fungi. With the hoopoes, actually, with some of them, rather than do a big bulky bandage, what I would do is actually use Granuflex, which is a kind of sticky dressing, actually sticks nicely to the foot, and then we'll pad the hospital cage with bubble wrap, actually, covered in just a layer of paper towel, and that means you can have a less bulky dressing.
Sure. Sure. So if I can just jump in there, Pododermatitis, obviously the etiology varies depending on the species of bird that you're dealing with. But if I can just share with you one case that I dealt with where it was a species of wader. I'm not going to tell you what the species was because it's a little bit sensitive, but they're very much an endangered species, and they had a really serious incidence of Pododermatitis. And because they were waders that needed to stand in water a lot of the time. And the issue was this particular zoo was not using F10 at the time. They were using a product which I hate to say is used a lot in UK zoos, which isn't efficacious against Pseudomonas. And the particular outbreak, of course, was Pseudomonas infection in the water, giving rise to the Pododermatitis. So just make sure that if you've got water around for a lot of time, that you are using a disinfectant that is effective against Pseudomonas, because obviously we know that's where Pseudomonas likes to be. Okay, so a polling question again, and I would stress that this question really is aimed at sort of bird of prey bumblefoot rather than different bumblefoots, because as I said, the etiology will vary dramatically depending on what species you're dealing with. So, A, E. coli is the commonest bumblefoot pathogen derived from food as a result of poor hygiene in food preparation, or B, Aspergillus and Candida species are common contaminants in bumblefoot lesions, or C, bumblefoot arises due to avascular necrosis due to pressure sores. Relief of pedal pressure is vital and bacterial contamination of infection is unimportant. Or D, in treating bumblefoot lesions, relieving pedal pressure is vital, as is controlling any fungal or bacterial infection, which is most commonly Staph aureus, which is not naturally found on bird skin in the wild. When in captivity, contamination occurs from their handlers' hands. Or E, Pseudomonas contamination of the bird pedal wounds is common as a result of birds standing in contaminated water bowls. So if you would like to poll away, and then we'll just discuss through the results as before. Okay, so everyone heard me when I was talking about bumblefoot in birds of prey, and of course birds of prey bumblefoot are typically caused by Staphylococcus aureus. And yes, the big difference is, of course, with birds of prey, whether they're a flying display in a zoo or it's a zoo licensed falconry center or privately owned birds of prey, the falconer will handle the bird's feet a lot, and that's why the Staphylococcus will be passed from the handler's hands to the bird feet. And because birds of prey don't normally have staph, their immune system is not able to cope with it, and that's why we get a problem. So yes, D is the most correct answer. Pseudomonas contamination of bird pedal wounds is common, and as I said before, if these are waterfowl and they're standing in water, certainly that is true, but it is we're really thinking about birds of prey in this case, but it's a good response all the same. A, E. coli is the commonest bumblefoot pathogen. Well, that's not true. It can happen, but it's not the commonest, and it's derived from food as a result of poor hygiene in food preparation. Well, that's the commonest source of E. coli, but I say it's not a common problem for us. C, bumblefoot arises due to avascular necrosis, pressure sores. That certainly is true. Relief of the pedal pressure is vital. Yes, that's correct. And bacterial contamination or infection is unimportant. That is wrong. As soon as you've got a pedal pressure and a breakdown of the natural defense mechanism, you will get bacterial and fungal contamination, and it is important, and you must control it. And B, Aspergillus and Candida are common contaminants in bumblefoot lesions. Now, actually they are, and this is where if you're putting a dressing on a bird and keeping it dressed up for some weeks, rather like humans getting athlete's foot and candida between your toes, this can happen with birds if they're hot and sweaty inside a dressing, which is, even if it's changed on a weekly or twice weekly basis, it can happen. So if you are redressing them, actually putting that F10 barrier cream on there to prevent that is a good thing to do. Okay, so back to you then, Michelle.
Okay, so a few slides on impacted glands. So impacted scent glands is something that we see in snakes occasionally. It does seem to be more common in female snakes. I think that's because the glands are bigger. Obviously, they don't have hemipenes. And sometimes they're just impacted. Sometimes they can get infected. You can try to manage them medically by things like warm water soaks, and you can also flush them out with diluted F10. It's not always easy because the duct isn't straight, so you have to be careful, but you can certainly manage them like that. If they don't resolve, then often we do have to remove them surgically. The other thing I've used F10 ointment for is impacted femoral pores in lizards. So I didn't have a picture. This is actually a chuckwaller that had a squamous cell carcinoma, but you will get impacted femoral pores where they get this sort of keratin debris building up, and you can remove it and then just put some F10 ointment into the defects that are left behind. Oops, sorry.
Sorry, I'm racing ahead of you there.
Oh, sorry.
Are we done with that one?
Yeah, we're done with that one. Sorry. Moving on to lemurs. So impacted or infected scent glands. So I have seen this. I've seen it in an elderly male ringtail, also in a, I think it was a gentle lemur. So I've only seen it really in old males. So I think, as they get older, a little bit geriatric, they're possibly not emptying the glands, not scent marking as they normally would. And this particular one, I don't have a picture of it, but he was an old guy that had, very swollen and impacted scent glands. We cultured Pseudomonas from it, and we were able to express the sort of brown fluid and flush them under anaesthesia, of course, with diluted F10. And then he also had 14 days systemic antibiotics, and then we saw him back in clinic and flushed them out again. And they improved a lot.
Good. Okay.
Abscesses, obviously, a fairly common presentation in lots of animals. So again, F10 can be really useful for flushing and packing abscess cavities. So at the top, we have a elderly honey badger. In this particular one, it wasn't dental related, but obviously quite often when you get abscesses around the head, there might be an underlying dental issue. At the bottom here, we've got a poodoo. Our poodoo actually also used to have problems with ear mites. And we used to sometimes put F10 ointment while they were under anaesthesia, just on the crusty bits in the ear. And we used to treat them with a topical product, selamectin, and that did eventually resolve the ear mites. This one on the bottom right is from Joburg Zoo. So this is a brown spitting cobra with a subspectacular abscess. So you can see the ballooning out here of the spectacle. And usually with these, infection actually tracks up from the mouth. So you always have to check for stomatitis. So it goes up the nasolacrimal duct. You get infection in here. So we just made a wedge, a little wedge in the spectacle, and then you can take samples for culture. So in this one, we got a staph and a Clostridium, and we actually put F10 ointment directly into we flushed it out first and then put F10 ointment into the eye.
And nice examples there, both with the honey badger and the spitting cobra, where, in all honesty, they're not patients that you're going to want to have to apply medication to on a daily basis. So great to be able to use F10 in that situation. Okay.
So sticking with abscesses, so this was a Bactrian camel that had a small but quite nasty abscess. So this was due to Actinomyces bovis. So obviously this can cause lumpy jaw. We had to debride right down to the bone. And then we used F10 wound spray to keep the flies off. And the reason I put the picture of the lion down here is that we had quite a big problem in Joburg with flies, both in the camel house and also in some of the big cats. So we would see ulcers on the faces of some of our lions, and also lesions on the edges of the ears from flies. And we weren't able to treat certainly the lions themselves, but we used the surface spray. So the F10 surface spray with insecticide, the keepers would spray that inside the camel house and also in the lion house, just to try and keep the number of flies down.
So it's interesting. Obviously, in that situation, you're talking about fly causing irritation, but of course, don't forget about the flies that are disease vectors, those that transmit hemoparasites, for example. Again, exactly the same way, we can very usefully use F10 surface spray with insecticide on the netting around the enclosure. So it's a really useful technique in a lot of different situations.
And then trauma, of course, we do see quite a lot of. I just put the flamingo in here. It was quite an unusual cause of trauma. So we had a typical sort of South African hailstorm, and we had a few flamingos sitting on eggs at the time. So they just stuck it out. One of them actually had quite a bad wing injury. It had to be amputated. This one had a nasty laceration to the neck. But this one we were actually able to suture. But often with traumatic injuries, we have to allow them to heal by second intention, and again we can use the wound spray or the ointment. One thing that we do see quite often is head trauma. At the moment where I work now, it tends to be in pigeons and doves that are very good at kind of getting spooked and scalping themselves. This one actually was a wattled crane, so we had a big captive breeding program for wattled cranes, and actually we would bring eggs in from the wild. So obviously wattle cranes normally only lay one egg, but occasionally you get a nest with two, and the second chick never survives. So they would bring them to the zoo and puppet rear them for the captive breeding program. And you need to be very careful. It's quite a difficult process to put these birds together into a cohort, because they exhibit canism where they'd naturally, one chick would attack the other. And this guy sadly managed to get over a fence into the wrong part of the enclosure, got attacked by some other cranes. He lost a wing, but he had a head injury. And often what I do with these is, again, I use the F10 wound ointment, and then I stitch some Granuflex over the head, and that works really nicely. And you just replace it every few days.
Obviously not relevant here, because you said that the crane got into another enclosure and was attacked by many. But one of the things I learned when I was doing a big captive flamingo breeding project again at Slimbridge was that when you take flamingo chicks, if you put two chicks, say 3 to 4 days of age, because we'd have them singly initially, when they were 3 to 4 days, we put two chicks together. If you did that, one will beat the hell out of the other one. But if you put 3 chicks together, you don't have a problem. So, all these species have their different little quirks, which of course Michelle is very familiar with, and me much less so. But it is interesting, these interspecies aggression and so on, and how to deal with it.
So not a lot to say here really. Obviously bite wounds can also be quite common. So again, we can use the F10 products. So we've got an aardwolf here, coati, and this is one of our group of meerkats that were fighting recently. We don't want to take them out of the group, but the nurse will just go and check them once a week. They'll catch them up, have a look at the wounds, and spray them with the F10 wound spray with insecticide. And some of them obviously would be on systemic treatment.
Sure. Good.
Moving on quickly. So this was a more challenging bite wound. So this was a capybara that had sort of multiple bite wounds, especially on the sort of right thoracic area. And initially there was just a sort of pocket which was discharging a kind of serosanguinous fluid. But when we opened it up, there was a lot of pus in there. So this is actually, I think, some F10 ointment in here. We placed a drain that was in there for a few days. And then we were quite lucky in that this was a capybara that was quite amenable to hands-on treatment. So we were actually, once the drain was removed, we were actually able to flush the pocket with diluted F10.
Sure.
And this worked really well. So we did this for about 3 weeks, and it healed really well.
And that's another lovely example. It's not often you will, in say a cat or a dog, you wouldn't normally open an abscess, clean it and just put a drain in and close it. You'd leave it open certainly for a period of time. And yet by use of F10 at the time of surgery and then flushing afterwards, you'd be able to manage it in a closed fashion, which obviously is much more appropriate in this situation.
This was another capybara. So You can see here it had some quite nasty elbow lesions, and these were actually secondary to quite severe pododermatitis. Again, we were lucky in that it was very amenable to being treated. So this is a veterinary student just putting some F10 ointment on the elbows. We cultured staph from those, but ultimately we had to sort out the foot problem, and this was quite challenging. We ended up actually having to amputate the end of one digit and put some gentamicin beads in because there was an osteomyelitis there.
Okay.
And then this was just a blue Dacre that had some horn trauma, so presented with hemorrhage and the horn just sort of hanging off by the skin. So obviously remove that off, and again, useful to use the wound ointment with the insecticide just to keep flies off while it's healing. And then interspecific trauma we see, so these were a couple of interesting cases. So this one on the right is a sulcata tortoise that was actually kept in the sable camp, so had a horn injury from a sable antelope. This is what it looked like at the top, and this was actually fly blown, so there were a few maggots in here. Obviously at the bottom, this is it having been cleaned up and debrided. And yeah, tortoises are amazing. They heal really well. So we were able just to flush this out. So use the wound spray to keep the flies off, and it healed really well. Another one on the left here. So this was a spotted eagle owl that had lived quite happily with crested porcupines. And one morning the keeper came in and found it with a quill stuck through the pectoral muscles and coming out the left shoulder.
Wow.
Amazingly, it hadn't really done too much damage. Seemed to have somehow missed the clavicular air sacs. But again, we flushed the tract with some F10. It had a couple of weeks of non-steroidals and antibiotics, and yeah, did really well.
Great.
Lucky. Treating Flystrike. So yeah, obviously this picture on the right is one that didn't make it. Unfortunately, didn't present until it was dead. This was a fruit bat, but I have treated Flystrike in a snow leopard. So it's not this particular one, but it was an elderly animal that was being treated for chronic renal failure. Obviously, cats are normally very good at cleaning themselves up, but because it was quite old and debilitated, it had a moist dermatitis, some urine scald, and Flystrike. And although F10 wound spray is contraindicated in cats, I have actually used it in big cats without a problem. This particular animal, we did euthanize quite soon after that. I've also used it in a red panda, which just had a little wound on the sole of the foot, which also was fly blown.
Okay.
And then preventing Flystrike. So this is one of our reindeer up at Wild Place. So this is a complication of castration. So obviously normally you get the antler cycle where they go into velvet and then they harden and drop off. But in castrated males, you find that they stay in velvet for longer than they should. And sometimes they do produce these growths called antleromas. And the problem with this is that over time, actually, the tissue breaks down and becomes necrotic. So they're very, very prone to getting Flystrike. Also, as you can see in this particular one, it was actually starting to interfere with his vision because he had to lift his head up to kind of see behind these large antleromas. So normally, you don't really want to remove the antlers when they're in velvet, but we did do that in this case. And in subsequent years, we injected with testosterone just to make sure that the normal antler cycle took place.
Sure. Good.
This is just a recent case, just a rhinoceros iguana that presented with this sort of ulcerated mass on the corner of its mouth. On biopsy, it was really just granulation, exuberant granulation tissue. But again, we were just using the ointment with the insecticide just to keep flies away while it heals.
Good.
Same kind of thing really with, when we're darting animals or putting ear tags in or doing neonatal checks, you can just use the wound spray just to keep the flies away.
Yep. So just to clarify, the wound spray with insecticide.
Yes, yeah.
Yeah.
And then, of course, post-surgery, it can be useful. So this was just a polar bear that had a kind of moist dermatitis on his head, had a couple of little lesions, which were, one was a benign hematoma, one was a dermoid cyst. And, usually the keepers are pretty good at training animals to allow them to continue applying the wound spray afterwards if necessary. I'll skip on to this one. So this was one of our Okapi, Kabibi, and she was 6 years old. This was her first calf. She actually went into labour about a month before the calf was due. This was actually before the CCTV cameras had been put up. So when the keepers came in the morning, she'd gone into labour, and it was a sort of normal presentation, but just one sort of fall-in present. And normally you'd expect parturition to happen fairly quickly. Because it was her first calf, we did give her a bit of time. In hindsight, I wish we'd intervened a bit sooner. But we're quite lucky with our Okapi in that they're used to going through this device. So this is, we call this our ORD, Okapi restraint device, and it leads from the stable to the paddock. So they go through it every day. And this, luckily, is our most kind of amenable Okapi. So she'll stand in the ORD for hoof care, for example. And when it was clear that we were going to need to intervene to deliver this calf, we were actually able to put her in the ORD. Keepers fed her favourite food, which is melon, which she doesn't normally get. But we're actually able to do an episiotomy. So just under lidocaine, did some sort of about 6 centimetre episiotomy incisions and remove the calf that way. Sadly, that one, it did have a heartbeat, but it didn't make it. This is actually a picture of her subsequent calf. But we were able to manage the wound afterwards, again, just by having the keeper spray F10 wound spray onto it as she went through the ORD.
Great. Okay, so a poll question. Which statement is most correct in respect of F10 with insecticide product? So A, F10 germicidal spray with insecticide is safe for use on all mammals and should be applied liberally to the coat once a week. B, F10 germicidal spray with insecticide, as with all medications, must be used with care in accordance with the manufacturer's recommendations. It should not be used in cats. The application rate is 1 pump per kilogram body weight once a week. C, F10 germicidal spray with insecticide, as with all medications, must be used with care in accordance with the manufacturer's recommendations. It should not be used in cats. F10 germicidal barrier ointment should not be used in ungulates due to sensitization to the lanolin carrier. D, F10 germicidal spray with insecticide is designed for use on solid surfaces and should never be applied to the patient's skin. Or E, the spray should be applied to the skin 1 pump per kilogram body weight every 3 days or as often as the coat gets wet. So if you would like to poll away. Okay, so everyone's doing pretty good. So, yeah, the majority are there. So the issue is that the permethrin in the insecticide should not be used in cats. As Michelle said, use your own professional judgment. If you've got a cat that really needs, if it's got myiasis and you need to use something, as long as you use it within the recommended level, you're okay. But generally speaking, not with cats. So B is good. E, a lot of people say the spray should be applied to the skin 1 pump per kilogram body weight every 3 days or as often as the coat gets wet. Every 3 days is a little bit too often. The instructions on the label say every 4 to 5 days and 1 pump per kilogram body weight, and that is fine. So that's why E is not ideal. A, germicidal spray with insecticide is safe for use on all mammals and should be applied liberally to the coat once a week. That is incorrect because of the fact you shouldn't be using it liberally in cats. And then C, This is where it says that F10 germicidal barrier ointment should not be used in ungulates due to sensitization to lanolin carrier. That's absolute rubbish. Lanolin, of course, is sheep wool, is the oil in sheep's wool, and does certainly not cause sensitization to ungulates. So there's no reason why you shouldn't use it in ungulates. And then D, lastly, there is an F10 surface spray, but it's not the germicidal spray with insecticide. So you just need to be careful to make sure you know what product you're dealing with, and you'll be absolutely fine. Okay, so let's move on from there.
Yep, so this was just a slide, really, just some sort of post-op complications. Probably the most severe one was, and I don't have a picture unfortunately, was a tapir. So this was a 3-year-old tapir that was castrated. Often, obviously, in the zoo world, we're doing surgery on section, a bit like a farm vet. And this animal had a closed castration, so that the idea being that he could go back in the pool sooner. In hindsight, I think we might have done an open one. Anyway, all looked good to start with, but then a couple of weeks later, it became apparent that the infection had kind of tracked up. We saw these sort of swellings over the flanks. We had to do another surgery, open them up. There was lots of thick pus. But again, you know, this was a very amenable animal, and the keepers were able to flush these abscesses with F10 really nicely. So they would instill some lidocaine first, and then he actually tolerated it pretty well. He also had trimethoprim, sulfonamide, and anti-inflammatories. And it took a few weeks, but they did resolve completely in the end. The pancake tortoise was just a sort of straightforward coeliotomy. She was egg bound, just remove the ovaries at the same time. Nice thing about pancake tortoises is that you can actually put sutures in the corner of the flap to stick it down. Generally did really well, but there was a point where she had some sort of fluffy growth around the wound under the bandage, and obviously easily dealt with F10. And then the one on the right is really just to sort of bring me on to amphibians. So this was a guttural toad that actually had a intestinal prolapse, which was caused by an intussusception. So again, it had a coeliotomy. Again, sort of healed well initially, but then a wound opened at one end of the incision, and we just managed this with F10 wound ointment, and again healed really nicely.
Great.
So moving on, we're nearly there. Oh, sorry, this has gone on a while, but moving on to amphibians. So the tomato frog. So this was a interesting case. When I was at Joburg Zoo, we dealt with a massive shipment, a kind of semi-legal shipment of reptiles and amphibians that were sent from Madagascar they were supposed to go to the Czech Republic. Obviously, this is the exotic pet trade. They got stuck at the airport at OR Tambo. SPCA asked us if they could bring these crates to us because they'd been stuck there for a few days. They suspected all the animals would be dead. And we opened these crates, and I think there were about 150 dead animals, but there were about 650 live animals that we then had to deal with. Obviously, very compromised, so lots of medical issues that we had to deal with. But amongst these animals were a group of 21 tomato frogs, and they developed ulcerative skin disease or red leg. So they presented with sort of hyperemia, ulcers, cloudy eyes, skin depression. And we treated these actually. They had systemic enrofloxacin. They had eye ointment. They were tube fed, but we also nebulized them with F10 diluted 1 to 250 every day for 15 days as a fairly non-stressful way of treating them. And I think 2 of them died. I think 13 of them out of the 21 show clinical signs, 2 died, and the rest all survived.
Good job.
I have also used F10 to treat rostral abrasions in guttural toads, and also used it to treat chytrid fungus in painted reed frogs. So these were some little frogs. We had a positive PCR, and we treated them with F10 diluted 1 to 2,000 in reverse osmosis water. They were bathed for 5 minutes every day and then subsequently tested negative. And we actually started doing a pilot study on tadpoles, and this actually led to the work that Shay Weldon did, which I think you're about to mention, aren't you, Neil?
I think in a couple of slides it'll come up. Yeah.
Oh, okay. So yeah, this is just our amphipod here at the zoo. So we have some really important endangered amphibians in there, like the Lima leaf frog from Costa Rica, and because we know F10 is safe in amphibians, it's very suitable for general disinfection and use in the amphipod.
Okay, so as Michelle has mentioned, Shay Weldon, on behalf of Health and Hygiene, did some very interesting and invaluable research on the efficacy and safety of F10 in the treatment of Chytridiomycosis in amphibia. Now, for those watching, I'm sure you're all aware that chytrid is globally the most important, the most threatening disease to many amphibia populations across the world. And so the ability to take amphibia into an ARC situation, into quarantine, to be able to treat chytrid and clear it from a population is absolutely invaluable. And what Shay Weldon was able to show is that you can treat adults with F10SC at 1 in 3,000. So you put them in a bath daily for 10 minutes and do that for 9 days. And with tadpoles, you do it at 1 in 100, 1 in 10,000 for 10 minutes daily for 9 days. And I should just stress that this research was done just with one species. But the point is there that you know, and I know a lot of zoos across the world now are using F10 on a routine basis in their isolation facilities, in their amphibia ARCs. So, you know, I think a big plus for F10 and Health and Hygiene for doing that research and finding that we can use F10 to save threatened amphibian populations. Okay, so another polling question. Which statement is most correct in respect to the potential use of F10SC in the treatment of Chytridiomycosis amphibian? A, Chytridiomycosis is an overrated disease which responds well to simple saline wash. If it is not appropriate to use F10 in it is not appropriate to use F10 in its control. B, F10SC is ideally suited to the treatment and control of chytrid due to its efficacy at very low concentration, at which it causes no damage to the amphibian tissue, together with the fact that it is highly biodegradable. It is effective and safe against chytrid in adult amphibians and in tadpoles at recommended dilutions and application methods. Or C, F10SC is effective against Chytridiomycosis in amphibians when used at 1 in 500 dilution once a week for 3 weeks. Or D, whilst F10SC is effective in treating chytrid, it is toxic to amphibians and should not be used for this purpose. Or E, F10SC is not effective in treating Chytridiomycosis in amphibia and cannot be recommended for this purpose. So it should all be very straightforward, having discussed what we've just discussed. So if you would like to poll away. And wow, isn't that surprising? Everyone's bang. I'm delighted to see everyone's still wide awake. And I won't go into it further, but you know, it can be used. It is safe. It is biodegradable, and it is a fantastic use for F10. Okay, back to you, Michelle.
Right, this is the last slide, and sorry, I was sitting in the dark. I couldn't get to the light switch until now. But yeah, I could only find one example, one invertebrate example, and this is in Partula affinis. So we have quite a few species of Partula here at the zoo. These are highly endangered snails from islands in the Pacific, some of which we've had literally the only individuals in the whole world. So they're all quite important. They're also tiny, and yeah, we did once have one that had a full thickness shell fracture that was unstable, and we used pieces of boiled eggshell that had been sterilized in F10 to act as kind of little bridging splints to stabilize the fracture in this little guy.
Fantastic, fantastic. Great. Okay. So I'll just going to finish off really and just run through very, very quickly key choice points for using F10. Obviously, we know it's safety to the patient and the user, and it's tested on end products by accredited external quality control laboratories. There's efficacy testing, again, by independent accredited quality control laboratories, and environmental safety tested by accredited quality control laboratories as well. And lastly, there is a lack of metal corrosion, and inhalation safety renders it safe and effective to be delivered by fogging. And again, that is contrary to pretty well all other disinfectants. It's produced by Health and Hygiene, who are an ethical, evidence-based quality manufacturer. They have added value to all their products by education, training, and the provision of application instructions, safety, and efficacy certification. Treatment products are obviously a great way to gain confidence in owners and in zookeepers and so forth. But of course, we shouldn't forget that F10 is also fantastic to be used within a zoo or a practice's infection control and biosecurity program, not only the F10 FC, but also the F919 degreaser and so forth. So I would like to thank you all for joining you. Obviously, we'll see what questions we have in just a moment. But before I forget about it, I want to remind you that we have the next presentation will be on use of F10 as a treatment product in wildlife, and that's on the 12th of October. So really looking forward to that one. And let's just see what questions we have to address in the meantime. So Ian Templey has asked, Dr. Barrows, what equipment do you use for nebulizing and what droplet size do you use?
Oh, well, that's a good question. We actually have a few different brands of nebulizer. So we have some cheaper ones that we give out on section. So if we're giving them to the keepers to nebulize animals on section, they get slightly less good nebulizers. And we have, in the hospital, we have... it's called something like an Easy Breathe. Are you familiar with that one, Neil?
I'm not, I'm afraid. Is that the ultrasonic one?
It's an ultrasonic nebulizer that does really nice small particles. So, and
it's quite quiet as well, isn't it?
Yeah. So that's the main one we use. As I say, we've learned from previous experience not to lend it out to the keepers, so they get slightly cheaper versions. Yeah.
Okay, that's very useful. Thank you very much, Michelle. But again, as we said before, the important thing is to use a nebulizer that's actually achieving a small droplet size. And then we have a question from Kathy Johnson-Delaney, and I'm delighted to see Kathy's joined us this evening. Thanks, Kathy. Great to have you here. And she's asking, are we using 1 in 250 dilution for nebulization as well as nasal and respiratory tract flushing? And the answer to that, certainly from me, is yes. Michelle, you?
Yes.
Yep, absolutely. So no problems, no reactions. And just to point out, Kathy is one of the leading exotic animal vets specialists in America. And of course, F10 is now available in America. It's great to have people like Kathy knowing what she can do. And then another question, if you use the shampoo on guinea pigs with dermatophytosis or to prevent it? Are we using it on with? Well, certainly I would be using it as a treatment, and I have on many occasions. And again, the main thing is we'd put it on, we'll leave it on for 15 minutes, and then flush it off. But also, of course, always remember to use the F10 SC in the accommodation to control the ringworm in the actual place that they're living at the same time. I haven't ever used it as a preventive. So that's a guinea pig question, so we won't bore Michelle with that one. And then Kathy's saying, thank you, Neil, good to see you. Well, great to have you here. Any other questions? I know it's been a long evening, but I think I would like to just say how absolutely fascinating it is. And, as soon as you're treating animals in the zoo environment, how you've really got to think laterally. And there are so many different situations where because you can use F10, let's say by nebulization, it can be low stress. You can use the ointment, so you're only having to put it on once a week because the animal is hard to get to, or is toxic or poisonous. There's lots and lots of different reasons for using F10 in different ways, so many more different ways than we've found to talk about in any of the other webinars, birds, small mammals, and herptiles. When it comes to zoo, we can really let rip and use it in so many different ways. And thank you so much, Michelle, for sharing and let's think, it's about 18 years zoo vet experience with us, which there's not many people do that, and it's really, really valuable for you to share those experiences, and with lovely pictures as well. So thank you very much indeed, Michelle. Thank you all for joining us, everyone else. And of course, if you've got other questions, you can fire them back to Health and Hygiene, and we'll field those questions for you. And as I said before, this whole presentation will be available on the Health and Hygiene YouTube channel within 24 hours or so. So if you want to have a fresh look or share it with your colleagues, then please do that. Any other questions or issues at all? Corne or Linda or anyone else? No?
Not seeing anything in the questions tab. Just a comment from Kathy, but it seems like we've handled all the questions.
Okay, fantastic. There's one more that Kathy just put on there saying, Kathy says, we use F10 on guinea pigs arriving. We spray, wipe down, really decreases ringworm. So basically, these are guinea pigs coming in for care and treatment. So yeah, she's using that in a preventive way, and fantastic to get feedback from someone of Kathy Johnson Delaney's experience and knowledge, that she's able to say that by doing that, they're reducing the incidence of ringworm outbreaks in their facility. So thank you for sharing that. That's fantastic. Great. Well, thank you all very much indeed. Thank you especially to Michelle. It's been a riveting, fascinating session. I'm sorry it's gone on, but I think really important to share as many of those cases with you as we could. So thank you very much indeed, and we'll look forward to seeing you all again on October the 12th for F10 treatment applications in wildlife cases. Thank you all. Thanks, Michelle.
Thank you.